Hi, in my video today I'm going to talk a little bit about stones of the gallbladder. As you know that gallbladder disease is very common in our society where stones start growing in the gallbladder and then they cause a variety of symptoms. I am Dr. Rajeev Kapoor. I am a colorectal and general surgeon at Fortis Hospital, Mohali, and have the expertise to treat gallbladder related diseases. So what are gallstones? Gallstones are obviously stones which form in the gallbladder. And what exactly is a gallbladder? Gallbladder is a small bag, an organ which exists, which is located below the liver and which helps in storage of juices when they're not being used. And for some reason or the other, stones do form in the gallbladder, and it's almost up to 10% of the population will get on to have stones in the gallbladder. What are the symptoms? Pain. Pain in the upper abdomen could be because of gallstones. At times there is and change in the pattern of digestion. So patient may be having fullness after meals, belching, not feeling good after taking meals, and then once the patient is consulted, the doctor advises ultrasound and the stones are discovered and the stones are causing these symptoms. The investigation of choice for gallstones is ultrasound of the abdomen. At times we need help of the MRI where if the stone has moved on, or we need to know the structure and anatomy of the gallbladder to facilitate our surgery, then we do MRCP, which is done with the MRI machine. Of course, blood tests and a few other tests are required before we are ready to treat the patient. Now, what is the treatment for gallstones? If there is no emergency, then these patients will go in for elective gallbladder removal, and the gallbladder removal is done laparoscopically. That means that small incisions are made, long instruments with the camera are inserted into the abdomen, and the gallbladder is removed. Of course, the gallbladder has to be removed to remove the stones. We cannot open the gallbladder and remove the stones separately. Coming back to what can these stones do if we decide not to get operated? Of course, recurring attacks of pain, and then subsequently these stones can block the gallbladder, at times cause infection in the gallbladder, can cause collection of pus in the gallbladder. These stones can move on to the drainage structure, the drainage pipes of the gallbladder, and then can get they can block those ducts. So patient may present with jaundice. Patients might get pancreatitis, and very rarely these stones can actually erode into the gut, into the surrounding intestine, and cause obstruction of the intestine. So when we discover these stones, ideally we should go ahead and proceed for elective surgery. At times in emergency situation, an emergency surgery may be required where this gallbladder has to be removed, and sometimes in emergency surgery the laparoscopic surgery may not be possible or attempted, and then we might have to convert to the giving an incision and then removing the gallbladder because of various adhesions and not being able to separate the gallbladder from the surrounding structures because of the pus or inflammation or both. How is this surgery planned? Of course, if everything goes well, patient is admitted on the day of surgery and discharged the next day. Because of very small incisions, the pain quotient is very less, and then some patients go back to work within 2 to 3 days and come back to us to look at the biopsy report later on. My advice is that if gallstones are found out, one should plan surgery, and especially patients who have diabetes should not even think of postponing this surgery for 3 to 4 months, because the sequelae of diabetes and infection, if there is infection in the gallbladder, can lead on to a lot of complications. Thank you so much and have a nice day.